This is a 2-year-old male who presented with a long-standing history of progressive loss of vision. The images demonstrate thickening and T2 signal prolongation of the prechiasmatic segments of the optic nerves from the orbital segment to the canalicular and cisternal segments. More posteriorly, there is markedly thickened and T2 hyperintense optic chiasm, which contacts and elevates the A1 segment of the right and left anterior cerebral arteries. At the level of the optic tracts, there is a diffuse infiltrating mass which invades and expands the bilateral thalami, optic radiations, basal ganglia, medial temporal lobes, and hippocampi. There is effacement of the suprasellar and ambient cisterns with mild mass effect and edema within the midbrain. The lesion demonstrates globular regions of enhancement on the post-contrast images. The imaging findings are compatible with an optic pathway glioma. There are 3 subtypes of optic pathway gliomas, including childhood syndrome with neurofibromatosis type 1, childhood sporadic, as in this case, and adult type. Typical imaging features include fusiform enlargement of the optic nerve with variable involvement of the more posterior optic pathways. The lesions are variably hyperintense on T2 weighted images, and enhancement ranges from minimal to intense. If there is a focal lesion involving the optic nerve, not like in our case, the differential includes optic neuritis, optic nerve sheath meningioma, idiopathic orbital inflammatory pseudotumor, or sarcoidosis. Proptosis may be a presenting symptom.